Good day, friends. This is Professor Adrian Kennedy, and I will be talking about corporate wellness. And I will specifically refer to the use of lifestyle management as a means of achieving corporate wellness. You may well wonder as to why I should use lifestyle management as a means to achieve corporate health. The reason is simple. In today's world, in current times, it's the way we live. It is our lifestyle that is the major cause of disease, mortality, and morbidity in the world. 80% of diseases are caused by the way we live. If you go back historically, you will see in prehistoric times, the major cause of death was violence, wild animals, and perhaps our enemies. If you move forward to the 13th, 14th, 15th, and 16th centuries and thereafter, it was living together in communities. We built walls to protect ourselves from our enemies, but within the confines of the walls, living close together along with our farm animals and house animals, including other humans, there was a transmission of disease, and this was known as infectious diseases. With advance in science and with research and with vaccination and immunization and medication and drugs, we have managed to control infectious diseases. But at the beginning of this century, we discovered a new cause of disease, and that was the diseases of prosperity. We came into a global village. We flew in aeroplanes. We traveled in cars. We were sedentary. We had abundant food, and this prosperity caused its own range of diseases. Lifestyle-related diseases include the heart attack, diabetes, obesity, hypertension, arthritis, spondylosis, psychosomatic disorders, stress and anxiety. All these are caused by the way we live. And as you can see at the bottom of the page, these diseases account for 80% of Medicare costs and death in the world. So you have on the one side the ailments, the lifestyle ailments, the heart attack and cancer and arthritis and psychosomatic ailments and digestive ailments, and also injury and accident caused by automobiles. And then on the other side, you have the causes. And you see that the major causative factors are stress, a sedentary life, an inappropriate diet, smoking, alcohol, which in turn causes injury. Now, these are the major factors. And therefore, if you want to improve corporate health, you will have to consider improving these lifestyle factors in the employee workforce. Now, when you look at the corporate workforce, which is the educated component, perhaps better paid than the normal individual, and compare them to other individuals in society, the small businessman, the farmer, you will see that the corporate executive is no more healthy than the normal person. They are physically unfit in larger numbers, they are overweight, they are highly stressed, smoking, and of course, all this adds up to the heart attack and cancer. And then when you compare within an organization, you will find again that the individuals who are more prosperous have a higher level of poor health than the worker who is less highly paid. Now, this research done several years back by me, covering thousands of individuals in an industrial organization, shows very clearly that the CEOs of the organization had higher levels of stress, they were probably more overweight, they had higher levels of hypertension, and all this led to a lower status in health as compared to the workers on the other end of the screen. So you see that the workers who were physically working and manually involved, as opposed to the CEOs and supervisors and managers who sit in air-conditioned offices, the worker has a health score of 68% as opposed to the others whose health scores range in the 40s and 50 percentile regions. Now, this poor health has its impact naturally on productivity. The workers are more absent. It also has its impact in cost, higher cost for medication, and therefore it has its impact on profits. Because it is, after all, the organization that covers the health insurance of employees. And you extrapolate that to the national scenario, and you'll find that in a country where the employees or where the citizens are less healthy, the country is less productive and has higher costs. This slide is very indicative. In more than 25% of corporates, whether it is in a single country or whether it is around the world, more than 25% of corporates have almost 60 days loss in terms of no work due to medical leave and absenteeism. And therefore, the World Health Organization decided that they would seriously look at advising and managing corporate health. And then we had various charters, starting in 1986 with the Ottawa Charter in Canada, and then going down to other parts of the world. Every 5 or 6 years, we had a workplace health promotion charter chaired by the World Health Organization. And in 2008, it was decided that every corporate organization, every industrial organization worldwide would seriously look at managing and supporting the health of its employees. 2 years later, in 2010, in Luxembourg, Europe decided that this would be compulsory. And 4 years later, in the United States, it was decided that in case an organization or an individual did not pay attention to their health, they would not be provided with insurance. These were penal clauses. And therefore, it's become necessary for us to have corporate solutions. And over the years, I, along with many of my other colleagues, have created a series of steps that corporate organizations may take in order to ensure corporate health, to ensure the well-being of employees and the productivity of an organization. Step one is age-old, and that is the annual medical screening. But since lifestyle is the cause of disease, we decided to add to it the health risk assessment tool, which evaluates lifestyle. We then decided that we would present the corporate organization with a corporate health audit, the same way as it has a financial audit, so that from year to year, the organization will know whether the health of its employees is improving or deteriorating. And then we decided to educate the employees on how to manage their own health and not be dependent on their doctors. We made sure that the organizations supported employees by making available systems within the organization, healthy canteen food, sports facilities, health education, and so on and so forth, to encourage employees to remain healthy. And of course, to award and reward individuals from within the organization who were healthy, and for the government to award organizations that promoted corporate health. So step one in the journey to corporate health is the medical check, the annual medical check. The annual medical check was traditionally located in hospitals. And the reason for that was that there was heavy instrumentation required. There were the instruments required in the lab to check your blood sugar levels or your cholesterol or your liver function test or your kidneys. We needed X-ray machines to check the bones. We needed the echocardiogram to check the inside of the body, the internal organs. And then we needed the CT scan in order to check the brain and other such important systems within the body. All this made it difficult and expensive. Difficult in the sense that you had to visit the hospital to have a check, and expensive in the sense that it costs money to do these tests. And therefore, it was decided by the US Task Force on Health that we would create a cheaper, quicker, more efficient system by which the health screening would be done within an organization itself, in one of the conference rooms, with minimal tests, just blood pressure, diabetes, and cholesterol perhaps, but along with a lifestyle evaluation. And therefore, that is the modus operandi today. Minimal checks, lifestyle evaluation that gives the individual an instant prescription and on-the-spot counseling. What do we counsel the individual on? And what does the health risk assessment provide to the individual? It provides him in a note or on the screen his risk for heart attack or his risk for cancer. What are his fitness levels? What is the status of the food he is eating? What are his stress levels? If he smokes, how is it impacting his health? Is he healthy or unhealthy? All these factors were identified through this mix of medical tests and lifestyle evaluation, and an instant prescription was made available. An instant prescription on exercise, a diet, how to manage stress, how to quit smoking or alcohol, as the case may be. And this was done along with a counseling session. We then move further, not just make available the health scan to the individual or the health evaluation to the individual, but to compile all the information of all the employees in an organization and create a statistical guideline. And this statistical guideline will be made available to the CEO or the CHRO of the organization to help them to understand the health status of their organization. As you can see on the screen here, you have an organization in which 89% of employees are physically unfit, 52% are overweight, 32% have stress, and the overall score is only 57%. So what do? You automatically think up solutions. Now these solutions are provided through an automated system in the scan itself. So you include fitness activities, weight management, schedules, stress management, and so on and so forth. You direct the entire organization's efforts towards improving health and improving the health score. Now, not everyone in an organization smokes. Not everyone in an organization does exercise. So each individual requires different inputs to remain healthy. But by and large, you have large groups of individuals who come into common categories. You have the individuals who are highly stressed, you have the individuals who are physically unfit, you have the individuals who smoke, you have the individuals who are on medication. You bring these individuals together, similar individuals together, and you deliver education to these individuals. So you have specifically directed health education workshops in order that the individual learns to manage his or her own health. And then, of course, it's not only the employee that contributes to corporate health, it is also the organization that must contribute to its own health. So, you're talking in terms of making available health education classes, you're talking in terms of making available healthy foods, fruit and vegetables in canteens instead of aerated drinks and commercial products. You're thinking of making available memberships to the gym. You're thinking of making available sports tournaments and walking programs within the organization, or perhaps meditation classes, or perhaps walking contests, and so on and so forth, in order to improve health. And then, at the end of the year, award the individuals whose health has improved. And governments must award the individuals, or the individual organizations that have promoted health within their organizations. There are several such awards which was originated in the United States in 1995, the Coops Award, and then we have India started the Confederation of Indian Industries Award in 2005, and the country in which I'm living, the UAE, from 2012 or 13 onwards, has also inculcated the annual Corporate Wellness Awards. Arabian Wellness, the organization for which I work, in particular, encourages education in the area of health, which means that we would like to teach our occupational health specialists, or we would like to make available our programs to our human resource individuals, specific programs on corporate health, on how you can improve the health of your employees. We teach the implementation of programs on exercise and fitness, in managing weight, in managing stress, in utilizing the health risk assessment tool. In other words, every organization must have a wellness champion or a team of individuals that promote health. And this exists already in several countries. It already exists. I recall in the 1970s, late 70s or 80s, I traveled to Singapore and was part of that country's move to create a workplace health program. We also created the school health program. After all, children are the future of any country. And the workplace programs that we created in Singapore are implemented now by almost every corporate organization in that country. And what do they do? You have the health risk assessment evaluation, you have counseling, you have sports programs within corporate organizations, you have free fruit and vegetables in the canteen, you have implementation of safety, health and environment within organizations, you have ergonomics within offices, and of course you have the health awards. And Singapore is not alone. The country that started this program, again in the 70s, the country that originated corporate health was the United States, except that their objectives were financial as opposed to health. Health was the means that they used to improve the financial output of organizations. A healthy employee is a more productive employee, and he costs less. And therefore, America started evaluating health from a return on investment perspective. And if you look right at the bottom, since I do not wish to take you through, or I do not wish to waste your time in reading the slide at this minute, just refer to the last line. AT&T USA has a workforce of about 350,000 individuals or more. They reduced insurance claims by $40 per person by health improvement. And this resulted in a saving of $14 million annually. And this was in the year 2000. You can imagine what their savings are today. Now, what do these companies do? All the companies on your screen, whether it is IBM or Accenture or GE or Microsoft, Motorola, Citibank, all of them, the largest corporate organizations in the world, all of them implement corporate health. And they allow themselves to be audited and evaluated for the Coops Award. And each of these organizations have received the Coops Award sometime during the last few decades. And what do they do? Exactly what we do. Corporate health is similar across the world. You make available a walkathon challenge or a weight loss challenge. You improve the ergonomics. You create smoking cessation programs. You inculcate family health. You do the health risk assessment and annual screening. Health workshops, sports activities and yoga. Healthy eating and free vegetables and fruits. Free salads. Health insurance, especially awarded to those individuals who are health conscious. These are the things that comprise a corporate wellness program. Now, I was in India for several years, several decades, and the Confederation of Indian Industry, along with the Apollo hospitals, also had a corporate wellness program and awards. We covered a single institution, the Apollo hospitals. We covered 500,000 employees from 500 corporates. We covered 30 townships comprising of manufacturing and service industries. And we made available health improvement to these organizations and rewarded the top 4 or 5 organizations in each category. If you were to ask the CEO of any organization, does all of this help? What are the benefits of corporate wellness? Is it worth spending time and money on this? And 80% of the CEOs say yes. Corporate wellness is a boon to an organization. The employees appreciate it. Their health improves. Our Medicare costs reduce. The organization's productivity improves. So, if corporate wellness is important and relevant to the health of an organization, what are the elements that are necessary for its success? Now, many aspects have been pointed out here, but I will talk about 2. Number 1, a corporate wellness program, in order to be good and successful, needs a buy-in from leadership. The senior management must promote and support corporate wellness. They must be convinced that it is good for the organization. Thereafter, the same methodologies of ensuring understanding from the CXOs should trickle down either by the CXOs themselves or by the provider of corporate wellness to the employees. And employees must be convinced that this is good for their health, good for their families, and good for the organization. So the two important components of a successful workplace health program is buy-in from leadership and buy-in from employees. And what are the benefits? The benefits to the individual are obvious. Individuals will lose weight, individuals will improve their fitness, they will reduce stress, they will sleep better, they will manage hypertension and diabetes far more effectively, they will quit smoking and manage alcohol, they will improve their safety levels and avoid accident and injury, they will improve the quality of their lives. They will even increase their lifespan, and during the retired years will live a far healthier life. Those are some of the benefits of a workplace health program. But how does the organization benefit? Quantification by several studies, the RAND study in the United States, the World Health Study, the studies in UK, the Boston study, the Harvard study, all these studies have indicated that corporate wellness gives you a financial return, a return on the investment that you make, the expenditure that you incur in promoting corporate wellness. Medicare costs drop by an average of 26% over time. Absenteeism reduces. Productivity of the organization improves. Human productivity improves. The cost-benefit ratio is 5 times more than the investment, which means that if you spend $1 million, your return will be more than $5 million. Corporate wellness is profitable. Now, this was established and proved way back in the 90s, 1990 to 1995, when I was the pioneer corporate wellness chief of Tata Steel. Our health standards, as you can see on the extreme, on my extreme left, you will see the health standards. 52% of our 500,000 employees had cardiac risk profiles, which means hypertension and diabetes, or overweight, or highly stressed. 58% were overweight, 69% were unfit, 48% had high levels of stress. And of course, we had 22% smokers. So the possibility of heart attacks and cancers loomed large on the horizon. And therefore, the organization, a very caring organization, decided to take care of the health of their employees. And in 5 short years, by implementing corporate health, the simple system of annual medical check, education programs, and implementing various health activities, just these simple methods improve the health of the organization. And then if you compare the improved results with the world standards, we were delighted to acclaim in 1995 that our standards, which at one time was the worst in the world, in 5 short years, we achieved the highest standards in the world. And not only that, the return on investment was born during that period. You will see that we had an expenditure of 36 crores. That is several million. But it was reduced by 1/3. Corporate wellness reduces cost and improves profit. I'm now located in the Middle East. I live in the UAE. The largest ceramic manufacturer in the world lives in the same city that I live, Ras Al Khaimah. They have about 10,000 employees. We took upon ourselves the responsibility of improving the health of these employees with the support of the management of that organization. We asked the organization to make available health education programs, gym and sports activities, and healthy canteen food. They already had hospital facilities and insurance, but we added to it promotive health, proactive health, education, educate the employee, make available sports activities, improve the canteen services, and then look at the result during the same 1 or 2 year period on the human productivity of the employees. Absenteeism dropped from 20% to less. Presenteeism, which is the ability to work productively, improved. In other words, they were more productive at work. Presenteeism reduced. Productivity improved. Medicare costs dropped. And how this was quantified from a productivity and profit component. Now look at the impact on the human. The red is 2014 and the blue is 2013. The individuals who are physically unfit reduced by more than 10%. Stress dropped. Smoking reduced. Cardiac risk reduced. Cancer reduced. The only thing that increased was health. Being in the Middle East, it is inevitable that you work with organizations. The largest organizations in the world come from Saudi Arabia, some of the largest. So we worked with 100 CEOs of Saudi Arabia. The Royal Commission of Jubail comprises of a commission of corporate organizations, 100 of their CEOs. In February 2015, we took a base understanding record of their health. Worked with them over 1 year. And mind you, this was virtual work. I live in Dubai, 1,000 miles away from Jubail, 1,000 miles away from Saudi Arabia. Yet, with the benefits of electronic support, with the benefits of the internet, with the benefits of so many health systems, we were able to advise the CEOs on how to improve their medical standards, the blood pressure and diabetes, how to reduce weight, how to eat the right food, how to go for the daily walks and do their mobility strength exercises, how to manage stress, relaxation, sleep, how to quit smoking or to reduce smoking. The end effect of all of this was that their health improved in every area. Their health improved medically by 12%. Weight loss dropped by 8%. fitness levels improved by 5%, stress reduced, smoking reduced, and the health score, the overall health score increased and improved. So what should an organization do? As a policy, what should organizations do? They must ensure that you have your annual medical checkup with screening and counseling for all employees. You must ensure that you have health education classes, specifically directed individuals with stress, smoking, weight loss, physically unfit, or in order to manage their medication. You must have health education programs, and you must improve the health and the lifestyle of the employees by having a walkathon challenge, a weight loss challenge, a sports and fitness challenge, a quit smoking challenge, and so on and so forth. These are the simple things that you can do to improve the health of an organization. And in doing this, the employee's health will improve and the organization will be more productive. Friends, thank you so much for giving me this opportunity to talk with you. As I mentioned, I am Professor Adrian Kennedy. As you can see, I work with an organization called Arabian Wellness. My email is there. In case you want to contact me, I will be happy to support any information that you require. Thank you so much.